Okay friends, now we will start with a new topic, that is oral manifestation of systemic conditions. So it has been seen that many systemic conditions have got oral manifestation. So a proper diagnosis of oral examination can reveal many of the underlying systemic causes. Thus, it is very important to examine the gingiva, the mucosa, the tongue, and the periodontium, everything to examine carefully, as they might reveal any of the underlying systemic causes. So here are few systemic causes which we are going to discuss. The first is the clinical presentation. If you see a patient with mucosal pallor or atrophy, it may indicate anemia. Oral manifestation can be mucosal pallor with atrophic glossitis, candidiasis, burning, pain, tenderness, and erythema. Now, oral mucosal pallor is difficult to appreciate usually because of the color. Okay. Then next, the mucosal atrophy or pallor may be seen in lichen planus. It is an erosive, diffusive, painful erythema. Erosive means there will be removal of the layer. It will be diffuse and painful erythema. Ulceration with a peripheral radiating white stray, which is usually present bilaterally on the buccal mucosa. Next comes the lupus erythematosus. It is a discoid lesion which has a honeycomb plaque appearance. Honeycomb means small. These kind of plaque occurrence can be seen. And erythema, purpura, petechial and irregular ulcers and cheilitis will be seen. Again, I am repeating. Lupus erythematosus might have discoid lesions, honeycomb plaque, erythema, purpura, petechia, irregular ulcers and cheilitis. Next is the pemphigus vulgaris. In pemphigus vulgaris, first occurs the oral manifestation, then on the skin and other parts of the body you might see. So first indication for pemphigus vulgaris will be oral manifestation, which will include painful ulcers, and Nikolsky's sign will be positive. That means when you apply a pressure, that means when you apply a lateral pressure on the suppose this is my lesion or the blister. If I apply a lateral pressure around here, the normal surface will disappear and this blister will elongate. It will spread. So that is what known as Nikolsky's sign is positive in pemphigus vulgaris. Next is the Crohn's disease. In Crohn's disease, there is a diffuse mucosal swelling, snail tract ulcer will be present. In lupus erythematosus, lupus erythematosus, there was honeycomb type of lesion, and in Crohn's disease, snail tract ulcer are present. Possible aphthous-like ulcers. Appreciation. Okay, now what is the treatment for Crohn's disease? Application of corticosteroid or injection of aminolone acetonamide. Okay, now next is the Beckett syndrome. It is a recurrent painful ulcers which involve soft palate and oropharynx. Recurrent painful ulcers, soft palate and oropharynx. Next is the change in the mucosal pigmentation, that is Addison's disease. Diffuse melanin pigmentation will be seen, candidiasis will be present, and patient usually are immunocompromised. Okay. Next is diabetes mellitus, that will have gingivitis, periodontitis, candidiasis, atrophy of the tongue papillae, taste dysfunction, salivary dysfunction, burning mouth, delayed wound healing. As you know, in diabetes mellitus there is delayed wound healing. Again, I am repeating for diabetes mellitus, what you will see: gingivitis, periodontitis, candidiasis, atrophy of the tongue papillae, taste dysfunction, salivary dysfunction, delayed wound healing, burning mouth. Okay. Next is the human immunodeficiency virus, that is HIV, human immunodeficiency virus, which is associated with PDL disease. So there you might see a linear gingiva, erythema, necrotizing ulcerative gingivitis, necrosis of the gingiva and the interdental papilla, halitosis, necrotizing ulcerative periodontitis, rapid loss of attachment, edema, pain and hemorrhage will be present. Okay. Next, in cases of PDL, bleeding and inflammation, in cases of thrombocytopenia, that means decrease in the blood platelet level, you will see petechial, purpura, erythema, ecchymosis, hemorrhagic bullae and hematoma. And also you might see that there is hemorrhage may occur with minor trauma, or very spontaneously hemorrhage will occur. Okay. So, pedial bleeding and inflammation conditions, thrombocytopenia, which may show petechia, purpura, erythema, ecchymosis, hemorrhagic bullae, and hematoma. And there will be on minor trauma also there will be profound bleeding. Next is the leukemia. Mucosal bleeding, ulceration, petechia, diffuse or localized gingivitis, enlarged secondary infection. You will see gingival irritation by leukemia. Most often it occurs due to acute monocytic leukemia and acute myelomonocytic leukemia. Acute myelomonocytic leukemia. Next is the gastroesophageal reflex. It will cause dental erosion, water brash, xerostomia, burning sensation, and halitosis will be seen in cases of GIT reflex. And sometimes dental erosion may require dental restorative treatment also. Other findings you might include finding usually resolved with the medical management of the gastroesophageal reflex disease. Next is the bulimia or the anorexia. That means when you don't feel like eating, that it will also cause dental erosion. Xerostomia, increased caries, sialoadenitis, that is bilateral palatal enlargement. And xerostomia and sialoadenitis usually resolve on normalization of the nutritional status, and xylogogues may help in such conditions. Xylogogues, which will artificial salivary supplements. Again, I am going to repeat. The first oral manifestation which we saw was the mucosal pallor and atrophy. It can be seen in anemia, lichen planus, lupus erythematosus, pemphigus vulgaris, Crohn's disease, and Beckett syndrome. Again, anemia, lichen planus, lupus erythematosus, pemphigus, Crohn's disease, Beckett syndrome. And anemia, mucosal pallor will be there, atrophic glossitis, candidiasis, burning, pain, tenderness, and erythema. Oral mucosal pallor, which is difficult to appreciate. Lichen planus, erosive, diffusive, painful erythema, ulceration, white striae, usually present on bilateral buccal mucosa. Lupus erythematosus, discoid lesion, honeycomb plaque, erythema, purpura, petechia, irregular ulcers, and cheilitis. Pemphigus vulgaris, first is occurs the oral manifestation. It has got painful ulcers and Nikolsky sign is positive. Crohn's disease, you should remember snail track ulcer, diffuse mucosal swelling, possible aphthous-like ulcers, application of corticosteroids or injection with triamcinolone acetonamide. Next is the Beckett syndrome. It is the recurrent painful ulcers which involve soft palate and oropharynx. Then comes the change in the mucosal pigmentation, Addison disease. It is a diffuse melanin pigmentation, candidiasis, and patient is usually autoimmune compromised. Diabetes mellitus, gingivitis, periodontitis, candidiasis, atrophy, tongue papillae, taste dysfunction, salivary dysfunction, burning mouth, delayed wound healing. Then comes the HIV associated pedial disease, linear gingiva, erythema, necrotizing ulcerative gingivitis, necrotizing ulcerative periodontitis, halitosis, necrosis of the interdental papilla, rapid loss of attachment, edema, pain, and hemorrhage. Then comes the pedial bleeding and inflammation. First is the thrombocytopenia, petechia, purpura, erythema, ecchymosis, hemorrhagic bullae, and hematoma. Profound bleeding on minor trauma also. Leukemia, mucosal bleeding, ulcerations, petechia, diffuse or localized gingival enlargement, secondary infections. Gingival irritation may be leukemia occurs mostly due to acute monocytic leukemia or acute myelomonocytic leukemia. Next is gastroesophageal reflex, dental erosion, water brash, xerostomia, burning sensation, halitosis. Next is the bulimia or the anorexia, that is also caused dental erosion, xerostomia, increased caries, sialoadenitis, bilateral palatal enlargement. So here I have taken a study that was done by Angela C. et al. 2010 in American Academy of Family Physician. Okay, this is kind of, remember that this systemic causes and all, you need a family physician. So family physician, American Academy of Family Physician published an article on oral manifestation of systemic disease, and they concluded that the oral manifestation of systemic disease can be cured with the systemic illness treatment. So once again, Angelina C. et al. In 2010 published an article in American Academy of Family Physician, published article on oral manifestation of systemic diseases, and concluded that systemic diseases का oral manifestation can be controlled with systemic treatment. I hope this much is enough. And also few more studies were done. That is, anemia is the most common in the Indian population. Malnourishment is the secondary to poor economic status. Vitamin C deficiency and anemia is very common. In cerebral palsy patient, altered manual dexterity is seen. Oral hygiene difficulty. An integral dental team approach is needed for not only systemic conditions but also oral hygiene and PDL health. Therefore, to increase the overall health of the patient. This was concluded by Divya Singh Hada in 2018. So, one was the Angelina C. et al. 2010, Divya Singh. There was C, here it is Singh Hada et al. 2018 on management of gingival enlargement by medical and non-surgical dental therapy in cerebral palsy patient, a case report published in International Journal of Periodontology and Implantology. So this is done here. If you have any doubt, please ask me in the comment section. I hope this was helpful for you. Thank you.